Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N Court, Dublin, Sara, Sarah, ANN, Sarah N Court, Dublin, California, 94568. My phone number is 408 687 1899. Let us start our new lecture on the cells. As you know, we are discussing about the cell, which is the single minimum unit of our body for body formations, how this our body is formed. That is the minimum unit cell. And if ever anything happens into the body that actually pertains to the cell, it means something has happened into the cell. Cell means does not mean one cell. There are trillions of cells inside the body, and they all are affected. And collectively, when group of cells are affected, they show their effects on the body in different organs or in different systems. In this way, so whenever we recognize a broader aspect of the disease, a broader aspect of the changes which occurred inside the cells, we diagnose it, we give name to that, that this is this, name the disease as well. But ultimately, the changes occurs inside the cell. And for this description, I have already described you how many organelles, how many these kind of parts are inside the cells. One by one, just like I told you about the cell membrane, cytoplasm, nucleus, chromosomes, endoplasmic reticulum, mitochondria, like ribosomes, centrosomes, microbodies, and cilias or flagellas. So, and all these things are the part of the cells, and all these things play a major role in the functioning of the cell. Lastly, we were discussing that if we are going from outside and entering into the cell, we have to pass through the cell membrane. And I told you there was no any specific type of door to enter into it, and that was known as permeability, and I have described you about the permeabilities. And ultimately, when this cell membrane is damaged, what happens to the cell and what type of changes we see inside the body, that has been described in English, in Hindi, in Punjabi, in all the three languages one by one. And today we are starting the other things. Now we have crossed the membrane, we have crossed that barrier of the cell, and we have entered into the cytoplasm. Whatever is inside the cell, inside the membrane, cell membrane, or the wall of the membrane, everything in total, everything collectively is known as cytoplasm. This cytoplasm is a content of a type of semi-liquid substance which is made up of lipids and proteins, and it has in it many different organelles, or you can say the many different departments of one office, and they work into that media. In other words, I described it as an environment inside the cell. Just like we have our own environment, in our environment there is a 480 millimeter pressure of the mercury always. And that always pressure is a type of environment in which we are able to work, and we can feel okay with that type of pressures on side on our body, and that's normal, that we do not feel at all that there is any pressure. The same way, the cytoplasm is a type of environment, and that environment is inside the cell. and are the organelles. All the organelles which are working inside the cell and performing different functions for the body and for the life as a whole, you can say, they live normally in this environment. That environment is of cytoplasm. And I told you about this one. This cytoplasm is a jelly type substance. It's not liquid, it's not solid, but it's a semi solid type of substance, and it controls the metabolic activities of our body. Just like in our environment, if there is a excess of carbons, there is excess of oxygen, there is excess of nitrogen gases, and all that, that makes difficult for our life to take breathe into it. Same way, this cytoplasm has control on metabolic activity of the cell. If the cytoplasm is in normal consistency, then this jelly-like substance work as a normal, and the cell organelles work functions normally. But if this jelly-like substance, that is cytoplasm, is not in a normal consistency, whether it is more liquid, whether it is more thick, then all the organelles will feel difficulty to work into that. Just like if you go onto the hills, top of the hills, there is a lack of oxygen, and it's difficult for us to breathe. We cannot breathe over there. Same way, this is inside the cell. The cytoplasm maintains a normal environment where all the organelles normally can work. But if anything changes in the consistency of the cytoplasm, then the organelles inside the cell cannot work. And this is also not only that they work normally in the cytoplasm, they are placed into their proper places and remain into their proper places, or they travel into that media, into that cytoplasm in a guided way, where they should move, where they are going, how distance it has maintained, whatever it is, everything is maintained, and that maintenance is done by the cytoplasm. It's only possible, it's feasible with the normal cytoplasms. So then if the cytoplasm is not normal, it means the organelles cannot move, organelles cannot work, organelles cannot perform normal functions. eh? So they cannot perform their responsibilities. And if they cannot perform responsibilities, as I told you, just like we breathe, there are organelles, I will tell you, in the cells, they are responsible for breathing. There are cells which are responsible for the excretions. And if the cytoplasm is not normal, then those cells, those organelles will not be able to excrete the extra substances from the cytoplasms. In this way, it plays an important role for the normal inside functioning from the membranes. Cell membrane to inside of the cells, it makes possible that all the functions, all the organelles will come to perform a normal functions. So in this way, it's more important thing for the cell, we consider it. And if this organelles is a defective, or you can say it's a more concentrated, it's more liquid, then all the organelles will not perform their normal functioning, and also there will occur a structural abnormality, because cytoplasm is the content inside the cell which makes possible, if the requirements of a cell at different places is a different, somewhere this cytoplasm cell needs that it should belong. And then if something is hard inside the cell, cell membrane will not be able to move, and become longest. If the cytoplasm is not normal and the cell needs to become more globular, it will not allow the cell membrane to move according to the global structures. So means outside structures of the cell is maintained only if the cytoplasm is in its normal consistency. So big thing. It's a big thing. Okay. So cytoplasm structural abnormality. If there be any structural abnormality, I told you yesterday when I was delivering lecture in Punjabi, in Hindi perhaps, yes, also in Punjabi, that when we make paneer from a milk and put something into the milk, milk has a specific type of consistency, density, and if we put something sour into that, lemon into that, that sheds off water. The solid content of the milk sheds off its water to one side, and the solid content and the water content are separated from the milk, divided into two parts. And if it is divided into two parts, both the parts will not allow the organelles to work function normally. In a thicker portion, they cannot work. In more liquid portion, they cannot work. And in this way, this cytoplasm will not allow the cell to move according to the demand. It can move irregularity. Somewhere it's a solid. At the solid place, anything, even it's a plastic type of things, it will not move. It will not curve. Whereas in the liquid portions, you can move it anyway. So what happens? One portion of that milk, one portion of that cytoplasm is in liquid. The other portion of the cytoplasm becomes solid or semi-solid. So ultimately, the structural change of a cell will become difficult. Whereas the structural change is required for the normal functioning of the joints, of others different organs, because they are to move. They are to move when they are performing their normal duties, they move. And that movement becomes difficult. Solid part will not allow them to move freely. The liquid part will become pulpy and more flexible. So everything will be disturbed. Means if the cytoplasm is not in normal consistency, under those conditions, the cell will become abnormal in its shape, irregular shape. Moreover, it's not normal shape, but it's irregular shape. Over liquid portion, it's a something different type of structure. Into the solid portion, then it's a different structures. And moreover, inside the cytoplasm, those organelles which are living normally in the normal cytoplasms, now they are not able to work normally in the solid portion or in the liquid portions. So that changes ultimately. Just like I gave you the example of when you go to high on the hills and the oxygen is less, you cannot breathe, or it's difficult for us to take a normal breathe. Whereas when you come downstairs in the grounds, and where there is a gravitation force of the earth, specifically, you can say it's a normal specific gravity of the strength, we feel normal. But even on the other hand, if we go down to that one, even then it becomes difficult. In this way, more solid, more liquid than the normal, both way, the cytoplasm creates a problem. Now, this structural abnormality is represented by the cell with irregular structure formations inside the body. And what happens? Why that milk, that the cytoplasm were having a different structures in one cell? Because it was shredded now. Solid portion has separated and liquid portion has separated. And it has happened because some toxins, some unwanted things has entered into the cell membrane because the cell membrane was damaged, and ultimately it has damaged the cytoplasm. Again, I will repeat, everything inside the cell membrane in the cell is known as cytoplasm. And if anything from the membranes enters into the cell, that's abnormal thing. Normal food, it goes, it makes the repair, it makes visible and make energetic to the cells. But ultimately, if any unwanted things goes over there, which cell does not need that one, or it's a toxic to the cell, ultimately it will be considered as toxin or as poisons, whatever. And in that way, the consistency of the cytoplasm does not remain normal. And if it does not remain normal, the organelles inside this cytoplasm will not be able to work normally. Means presence of a foreign body anywhere inside the organs, anywhere in the cells of any organs. When this happens, this gives a different shape to that organs. Suppose uterus or breast, just easily you can understand, I can give you the examples. Uterus or breast, the cells of the breast or cells of the uterus has defective cytoplasm, because of the endotoxin or the exotoxin, whatever may be the reason. And then whatever has entered into the cell, that has changed the structure of cytoplasm. And cytoplasm is not of the equal or similar consistency all over inside the cell. Somewhere it will be more liquefied, somewhere it will be more solidified. And in this way, both the organelles, both the persons, you can say, living inside the cell, who are working inside the cell, in the solid portion, they will not be able to work normally. In the liquid portion, they will not be able to work normally. And also, it will give an abnormal shape to the cell. Main thing, abnormal shape into the cells, because liquid portion will come upward, the solid portion will become downward, and the solid portion will do not allow more flexibility to the cell membrane, as to the watery portions of the cell will allow the more flexibility, or the structural change into the cell if ever it is required. Then the cell will be deformed in structure. Outsidely, if we see that kind of thing, then outwardly a cell's structure is irregular. Normally, it's totally regular structures. And normally, inside the membrane, this cytoplasm is simultaneous, similar all over. But now we are talking about that the cytoplasm is defective. And if the cytoplasm is defective, it means somewhere it is liquefied, more liquefied, somewhere it is more solidified, and both way it is abnormal. And both way, the organelles living into these portions will not be able to work normally. And it will give outwardly a destructive shape, irregular shape of the organ. Because in one organ, I'm not talking about one cell, multiple cells are going this kind of structure. This cytoplasm is damaged. In this way, one, two, three, four other trillions of millions of cells are making a one tissue, and then making a one organs, and ultimately all those are having the similar type of conditions. And in this way, ultimately, I want to convey you that they will give a irregular shape to that organs. Wherever this kind of conditions you see localized from outside toxins or from inside toxins. or from inside injury, or from the outside injury. Anyway, the cytoplasm has abnormal structure, thereby cell structure is abnormal. Cell structure is normally round, but it has become abnormal structures. And these kind of things when happen, because where there is a solid portion, it will put more pressure on the nerves, because everywhere I told you there is a circulation. Circulation means arteries. Arteries are supplying the blood from heart to each and every cell of the body. Veins are draining the used blood from each cell, ultimately sent back to the heart. And now, side by side, a nerve is passing along with the blood vessels. A lymph channel is passing along with the blood vessels. So, four things are passing. Four things are passing side by side from each cell to their ultimate destination. Arteries and veins destination is different. Arteries destination is from heart to the cells. Venous destination is from cell to the heart, and nervous system from cell to the brain, and relatively from brain to cell. And in this way, the lymph from cell to the spleen, and they have their different destinations, but they all these four channels are going together to all together. So all together when they are going, but now I am saying the cell has become irregular in shape. Somewhere it's light in pressures, somewhere it is putting more pressure, and when the more pressure is exerted on the nerve, nerve is a type of telephone linings, just like our telephone lines. If telephone line is defective, sometimes in the phone we see different noises, different kind of noises in these phones when we pick up any phone. Or ultimately, in the other side, sometimes if something is happening the same way, we can listen the noises from the other sides. So this is what happens inside the cell, and that sends the signal when the pressure puts on the nerves. It sends the signal to the brain that something is defective, and that is considered as pain. So if the cytoplasm is defective, then the underlying nerve will be pressurized, and when the underlying nerve is pressurized, it will send a signal to the brain that it is complicated there, means there is a pain. We indicate as a pain. So in this case, neurological type of defects we can see if the cytoplasm is defective. And ultimately, when there nothing is coming up, no order is coming up, or no condition of the local cell is extended back, sent back to their source for the help, then ultimately nothing is coming into that cell and nothing is going out to the cell. Ultimately, what happens? That cell will go deteriorations. That is known as degeneration. Ultimately, that cell will degenerate when it disconnection. A type of, you can say that connection is connected. Connection is disconnected. That its information is not sent to the brain. Brain is sending, but it is not reaching to the cell destination. That what to do in this condition, because there is a pressure of cytoplasm. So, because of the cytoplasm pressure, the real order from the brain, the real sensation of the brain does not go into the cell for normal performance, for normal help. It cannot get it. Same way for the arteries and veins, they cannot supply it because cells are becoming solid and hard, and in this way, when these solid portion of the cell means cells, many cells, ultimately when they enlarges, when they become more bigger, when they become multiple in these same conditions, ultimately a type of cyst, a type of tumor filled with sac, filled with liquid may come up. And ultimately, if the cell's shape is defective, then all the cells of that area will be defective. Then all the collective cell defection will indicate enlargement of the organs. And that enlargement, if it's normal, it's not dangerous, it's not cancerous, it's nothing like that, then it is known as cystic fibrosis. Fibers are collecting, and there is a cystic content inside liquid. He is deposited inside that organ, and that give outwardly a shape of the organ which is not regular. Just like, for examples, if this thing happens into the breast of a female, ultimately, and if we see outwardly to the that breast, and we will see that this cytoplasm on whatever side of the breast has changed in its structure, then it has given a shape to that organ like a cystic fibrosis or cystic or tumors. Cyst and tumor, there is only difference that the cyst is filled with liquid. When that liquid dries up, it becomes tumor. And ultimately, they are giving hard structure, hard and disfigured of this organ. The breast will show us is something hard, something bulging out over and excessive than normal boundaries. So over and excessive than their normal boundaries, the breast will enlarge, which we can see from the outside. The same way, same thing happens in the ovary, same thing happens in the uterus, same thing happens in the liver. Everywhere, when the cytoplasm is abnormal, it shows the abnormal shape and structure of that organ. If the multiple cells are involved, and by inspection, we can check that the shape of that organ, if it's visible outwardly, is not normal. If it's a pulpy development, norm is a normal. Every organ has a normal circumference and shape. According to the shape, if this shape does not remain normal, it means something has bulging out inside the organs. And that is all because of cytoplasm. It is making disfigurations inside the cytoplasm. So first thing which we see when the cytoplasm is defective, we see the you can say the protein, because everything is inside the protein. Everything is protein and fats. They are composing the cytoplasms. And then this protein has shed off. Under these conditions, this protein becomes different type of balls, you can say, not in one shape, but different shredded pieces you can see inside the cell. That not only in one side, one of the cell, multiple cells and a multiple group of cells, they are involved, and they are having this kind of clumps of the proteins. Different type of solid materials is collecting in some one side, and the liquid is connecting in one side, and that gives abnormal, irregular shape to the organs. This is what we see. And if the neurological defects ultimately are because of the enlarged state of any organ, the neurological defects occurs, ultimately there is no information, there is no order from the brain how to deal with all these things. Ultimately, the degeneration will occur. So first change is inflammation, second change is degeneration, and third is a necrosis, fourth is gangrene. Ultimately, if we cannot cover all these things, if you do not know all these things, then ultimately it will converted into cancer stage: cystic, ovarian cyst, uterine fibroid, nasal polypus. Anywhere this can happen, and anywhere cysts can occur, anywhere they may convert sometimes into cancer. It's not necessary that all the cystic or all the fibrotic things will change into cancer, but may change. So therefore, we recommend it ultimately early and immediate resolution of all these things, why it is happening, and we should correct that cytoplasm in whatever way we can do that, so that this cystic fibrosis or the fibrosis should not increase, and ultimately should not cause any problem in the normal functioning: arteries function, veins function, and that lymphs function, and also the nerves function. So all these functions, four functions with which a cell, four functions with which a cell is connected with the whole body. And if that connection is not working normally, it will be separated, isolated, you can say. The cell will be isolated. And when it is isolated, have no relation with the other cells, what will happen? Ultimately it will lose its structure, it will lose its function, and ultimately it will lose its own control. And when it loses all control, then ultimately its own garbage which is deposited over there will give a abnormal and large shape to that organ, or that to the cells, and ultimately that tumor increases, that ultimately the pain is increases, ultimately that the structurally from inside it is changed. And if it's changed from the inside, you can well imagine what will happen. Ultimately the large number of cells are involved, and which are having abnormal cytoplasms. So fluid filled sacs gives a different kind of shape to these cells, and sometimes it creates vacuoles. At one place there is a solid, at one place there is a liquid. Sometimes there may remain a space where there is nothing, liquid, and that may be filled with the air, that may be filled with the carbon dioxide, that may be filled with the notorious gases, which ultimately burst out and rupture the wall of the cell, and ultimately makes an ulcer. So this is what happens in case if the cytoplasm is abnormal. Means one cell, two cell, ultimate multiple cells, they are defective, and because they are putting pressure on the excretion side. Excretion side means venous. Excretion side means the lymph. Excretion side means the nerve control. So ultimately, they were discharging their order, their request to the brain. Ultimately, they were discharging the excretions to the appropriate way, and the veins will discharge it into the heart, and the in the same way the lymph will discharge into the spleen, so that the toxin will be utilized and excreted. And if because of the large tumor and this kind of cytoplasmic changes in the cell, then that garbage will remain there, and it will fermentate. It will cause more and more gases. It will enlarge the cell more and more, and it will give a different shape to the organs, more and more larger and bigger and painful. And ultimately the cell will rupture, and cell will rupture, and what will form? The ulcers. From cyst to tumor, tumor to hardness and ulcers. So ultimately these kind of structures at different organs produces different type of diseases. Just like if it's in the ovary, If it's in the genital organs, if it's in the testis, if it's in the uterus, if it's in the fallopian tubes, what will happen? It will create a state of infertility. Means that person, male or female, having this kind of problem, the cystic abnormalities, will not be able to reproduce. Means sterility. They are unable to reproduce their child. This can ultimately happen, that is known as infertility. And ultimately, a type of spasmodic conditions, because water, there's the water. It will move here and there. The solid will move here and there because they are not normal consistency. So it will create a state of spasms. So if person is having spasm, any type of pain spasms, vomiting spasms, anything, if a person is having a different kind of spasms, dore, convulsions, you can say, it indicates the cytoplasm is defective, and the cytoplasm defective is not performing its normal functions. It's not giving a normal shape to the organs. Wherever the cells are having this cytoplasmic type of defect, they are unable to perform the normal structures of the cell. In this condition, a very difficult state which ultimately can convert into malignancy, rather many times, just like I told you about the uh, skin tags, warts, tumors, cysts, papillomas, all these things remains a long time with the body without any abnormalities, but sometimes because of the excessive garbage collected over there and is fermentating over there, may cause gaseous things, may cause rupture of the cell walls, and that infection may spread widely, and that kind of thing is very serious. And cyst, tumors, cancers, all these things can occur. And when the neurological system is damaged, especially in the brain, it causes Alzheimer's. And when these neurological abnormalities are peripheral, then there is a Parkinson type of diseases in coordination with the brain and the physical structures, that is known as Parkinson's. So this may happen because of this abnormal cytoplasm. Means the excessive residue of the garbage is remaining inside the cell. It is not being discharged via the vein or via the lymph node, and in this way veins are swelled up, engorged, and the same way they are containing the thick blood going backward with the garbages, excessive garbage. And in the same way, everywhere, everywhere where there is going, it causes abnormality of the function of that organs. Now, if this kind of state is happening to someone, how we can diagnose it? First of all, I told you by the inspections. When you do inspection of any organ, and we have in mind that this is the shape of the breast, this is the shape of the testis, this is the shape of the, just like its internal organ we could see by x-ray and everything, like the uterus or any other organs. But if we see that shape either in whatever devices we are using, external by the eyes, internal by the different devices, we check that some of the organs are not having their normal structure. They are deviated to one side, to other sides, and making a different irregular type of shape of the organs. It shows that cytoplasm is defective of this cell, and it is detected by the microscopic examination of the cell, just like they say take the biopsy, cell biopsy. Sometimes they take a needle biopsy. By a needle, the fluid is taken up, and cells, uh, in one drop, you can well imagine, in one drop, about 5,000 cells are accumulated in one drop. But how much is one drop? And one drop may have more than 5,000 cells in that one. That minor thing is a cell. So ultimately, cells are defective and they are checked under microscopic by the biopsy or from outside by the shape of the organs. Suppose if there is nasal polypus, same thing has happened inside the cells. And you will see the septum of the nose is deviated to one side. If it comes into the eye, the same way the eye will be deviated to one side. Same way happens into the uterus and also in the ovary, because their cytoplasm is defective and it is giving a different shape, basically irregular shape to the cell. And that ultimately may be converted into different symptoms, just like I told you about the Alzheimer's, about the Parkinson's, and about the cancerous type of stage, or about the spasmodic type of pain, spasmodic type of conditions, because that amount in the cell, one side it is liquid, the other side is solid. It's not an insoluble type of consistency. So in this way, cell is not performing normal function. That's spasms, irregularity in the function, conduction. So conduction is abnormal, and then it is detected by the abnormal function of the organs. Genetic testing nowadays is done by motor neurons. And the motor neurons, Alzheimer's, this is what the Parkinson's, all these type of diseases have their cytoplasm defected inside the cells. And also, I told you about the cancerous stage. When any cell becomes abnormal, has overgrowth, irregular, has overgrowth hard, which was not normal previously, and this overgrowth ultimately converts into pain, then it is called cancerous stage. So this may become a cancerous stage because this is known as the metabolic abnormality. When anywhere cancer occurs and it is diagnosed by the doctors, it's a cancer. It means the cell is abnormal because of the cytoplasm is defective, and the cytoplasm defective is not performing the normal metabolic rate. Normal metabolic rate is defective, and this way it may convert into cancer cells, mean the a type of malignant changes inside the cell, a type of irreversible, you can say the irreversible changes inside the cells can occur if the cytoplasm of most of the cell is defective, and it's a different kinds of cells. Somewhere it becomes irregular, somewhere it's liquid and flexible. So all these things can add up to the diseases, and most of the general diseases are related to the brain, related to the heart, related to the respiratory organs, related to the kidney as well. So all these are the organs which are mostly affected if the cytoplasm of that area of cell is defective. And normally, automatically, if ever whatever the organ is involved, its function will not be normal. And second, I told you, when the excretion has obstructed, excretion of any cell is a necessity because food is coming up, and the waste is excreted out. And if the wastage is not excreted out under those conditions, it causes fermentations and ultimately rupturing with the gas formation, the rupturing of the cells. And rupturing of the cell can ultimately become a cancerous type. The solution, basically, the solution inside the cell, which is totally known as cytoplasm, and inside the organelles, whatever the liquid, just like the nucleus. Inside the nucleus is a similar type of a liquid, and inside of the other organelles also, inside of those, there is a other type of liquid named differently. And if the cell is increasing in its abnormality, then what happens? The solid substances ultimately crystallized. Liquid portions ultimately becomes more thicker, and the solid portion of the cytoplasm becomes also hard. And in this way, these are known as, you can say, just like a pond is having water and is moving normally, fishes and all that are moving normally. But if that pond is defective, suppose ice, due to winter the ice has come over there, and ultimately fishes and the other animals living inside the water will not be able to move normally. When they're not able to move normally, so this is what happens inside the cell. If the cytoplasm is abnormal, the cell is unable to perform its normal function. If the pond will dry up, the water will ultimately dry up. So that kind of condition is more smelly, more offensive, and more difficult, and we will not be able to bear that one. The same thing happens. Foul smelling ulcers, foul smelling tumors, even the skin has a foul smelling of the body. And ultimately, inflammation, degeneration, necrosis, and gangrene. So, all these are the stages of deterioration of the cell. If in the initial stage, a little defect in the cytoplasm, that is producing a condition inside the outside the body, what we will presume, that is known as inflammation. And within this inflammation, pain is there, redness is there, immobility of the cell is there. All these things can be there. And ultimately, the cell cannot perform its normal function. And after that, the garbage is collected more inside the cell. And if the garbage is collected more inside the cell, it will fermentate over there. And when it fermentate over there, it produce more toxic gases inside that, and ultimately it will increase in size. And when they will increase in size, it will rupture the outer wall. That will become ulcer, foul smelling ulcer, because the garbage is coming out. Garbage which was stored inside, which was not being delivered outside, which was supposed to be, then with the ulcers it will come out and it will be foul smelling. So this is what happens inside of the cytoplasm, that physically, outwardly, I can repeat it. First thing I told you, when you enter into a cell, because the cell membrane is defect or even normal, inside the cell membrane, whatever is inside the cell, that is known as cytoplasm. And cytoplasm has a type of environment, a type of liquid, you can say, jelly type substance, in which there are different organelles performing different functions for the life. Even the nucleus is also in the cell, in the cytoplasm. So if the cytoplasm is defective, it becomes just like disfigured, constitutionally changed. And just like I gave you the examples, when we make paneer and when butter and all that, and you put something sour into the milk, and milk will shredded, water will be separated, solid will be separated. Same thing happens inside the cell. And when this thing happens inside the cell, those cells which were able to move normally into the normal content, jelly type of content of the cytoplasm, now they are not able to. In more liquid, they are not able to. In more solid, they are not able to. So ultimately, the cell function will be damaged. And cell function damaged will produce abnormal, irregular shape of the organs because the excretion has obstructed. And signal to the brain is not going, and order from the brains are not coming back to the cell, disconnected. So ultimately, cell goes into deteriorations. And when this kind of condition happens in one organs or in a local part of any body, any type, then it produces a cystic fibrosis, cyst, tumors, warts, papillomas, all these things. And ultimately, because the nerves are connected with that one, it produces neurological defects of the Parkinson, Alzheimer's. All these type of things can happen because of the cytoplasm was defective. And then, when all these things are happening into the cell, then what we have to do again for the treatment purposes, I have told you to watch out the endotoxins, to watch out the exotoxins, and then find out the reasons behind that. Even sometimes it happens that the normal things we are taking regularly, and we do not feel that this thing in a food I am taking regularly, this type of environment I'm living in normally since long. And sometimes you do not consider it, that it may cause harm, it may be the cause of my disease. Under those conditions, under those conditions, medical philosophy advises us that we have to find out the causes. I told you time and again, we have to find out the causes, internal or external, endo or exo, disease producing or the cytoplasm defective has made because there is a toxin inside, or because the toxin is entering from outside into the cell. Then we have to survey about that. And then we come across some of the exotoxins. It's very difficult. If it's internal endotoxins, we know that kidney is not functioning normal, liver is not functioning normal, pancreas is not functioning normal. So then we know that this endotoxin is produced by this organs, and then you will try to treat that organs properly so that it should function normally, and it should not produce excessive garbage than normal. But there is a problem in the exotoxins. When things we are taking normally, regularly, every day, we do not doubt them that they can produce disease inside our body. But in a long run, ultimately, the things which body was adjusting for a long period, and you think these are the normal things for eating, for environment, and everything, but ultimately you are suffering from this thing, and you did not find anything internal toxins. Then the only source that we have, the external sources. And external, we are finding out in a routine that no, everything I'm eating normally, the same environment I'm living in, Same type of habits I'm doing that one. But ultimately, when this kind of condition, undecided conditions, happens in the history of a patient, then we have to survey its normal routine of living, normal routine of its working, normal routine of its eating and sleeping. Out of these things, you will find many things that this thing, first of all, a person is eating curd, buttermilk. Since long, he said, "Oh, I'm taking it since a childhood." It may be, it may not be the cause of my disease. I'm taking this medication, I'm taking that medications, I'm taking that kind of foods, I'm taking living in this type of environments since long. No, this is not my cause of my disease. But ultimately, there remains only one way to work it out, that stop all the things. Stop all the things. Change his living behavior. Change his sleeping behaviors. Everything change. And now add all those things, food, diet, everything has been changed, the routine has been changed, and ultimately start giving one by one all those things, and you will find out what is the cause of that one. First thing, when you start in this way, you are avoiding that environment you are living in. You are avoiding those foods you are living, you are eating that regularly, all that one. The sleeping habits. You are sleeping every day, or you are keeping night watch. You are doing your job at night and sleeping at the daytimes. So, what you have to do? You have to change the patterns for the sake of your health. You have to change it, and ultimately you will see, if under these conditions, for the sleep, he is taking sleep. He was taking day sleep, but now he is not taking night sleep. Now put him into the night sleep. Change the duty. Ultimately, whatever he was eating every day, change this food. And ultimately changing the environment, changing the food, changing the living his routine habits. Ultimately, if you see that he is improving, because food you are giving different foods. We are giving him advised foods, specific type of foods, and if he improves, it indicates that from all these conditions, his living, his sleeping, his eating behaviors are having the cause of his disease, that is the external exotoxins. So then, if you want to find out which was the cause, then add all those things previous which he was eating and become sick. I think nobody like to take the risk. But even then, if you want to go deep to the reasons that what was causing my disease, then ultimately you can add one by one, all those things to his diet, to his sleep, to his living behaviors, all these things, and you will find when you add a specific type of things, which was you are in a routine eating, living, or everything, and again the disease starts, then you come to know that this was the reason of my disease, and that has to be changed. Though it was a normal routine, you were not expecting that. This is known as maintaining causes. Sometimes exotoxin is produced by the maintaining causes. Maintaining causes are always friendly causes. You do not doubt that he may be my enemy, and you are using it regularly. But ultimately, when you become sick and you are not finding out any cause of your disease, then you have to do this experiment I told you. And if this is recovering you from the disease and the cytoplasm becomes normal, ultimately you will become normal with a changed behavior, with a changed sleep pattern, with change eating habits, all these things. So today our time is over. Me, Gurdeep Singh Sandhu, your homeopathy consultant. My clinic address is 9701 Sarah N. Court, Dublin, California, 94568. My phone number is 408-687-1899. Anytime, if ever you want to consult me regarding your running treatments, you can call me at 408-687-1899. I can guide you whether your treatment is going wherever you are getting your treatment. So it's okay. But if ever you want to take a second opinion about your disease, I can guide you what's the nature's principle about your disease, what the nature's principles when this kind of disease happens, what may be the causes behind that, and when you go towards cure, you are returning your health, what the sign and symptoms you will see in a disease, that will indicate that whether your treatment whatever you are taking is a normal or abnormal. This is what I can guide you. And if ever you want to be treated with homeopathic a specific type of treatments, it's a definite approach to your health. And then you can call me at 408-687-1899. If you are far away and you cannot use your phone, then you can send me an email, homeomedicine, HOMEOMEDICINE at yahoo.com, and convey your message to me, convey your complaints to me. I will advise you properly what to do, what not to do. So God bless you all. We'll see you tomorrow at the same time, and tomorrow's lecture will be in Punjabi. The same thing, this cytoplasm is defective, and in the defective cytoplasms, what are the signs and symptoms and how it happens, I will describe it tomorrow in Punjabi. God bless you. Rab Rakha. Will see you tomorrow.